you're not totally at the mercy of your immune system. There are so many other factors to consider which directly impact your gut health. In this video, we're going to explain the difference between Crohn's and colitis and go through some of the steps that you can take to help improve your condition. My name's Josh Deck. I'm an ex-paramedic and holistic nutritionist specializing in inflammatory bowel disease. And because of the great successes that my clients have had over the years, I've had the privilege of working with doctors across the country to help their patients clinic as well. So IBD is a progressive disease. It falls under two main umbrellas. That's Crohn's and colitis. Though the precise root causes are not completely understood, it is understood and accepted that there's an immune component to it. But we also know that there are many, many more contributing factors, which means that you're not totally at the mercy of your immune system. Things will matter like your food and nutrition, sleep, stress, alcohol intake, smoking, immune function, of course, bacteria, sugar, and so many more things. When it comes to bacteria, it's specifically your gut microbiome. So that's just a quick list of all the things that impact IBD directly and indirectly. And so we're going to go through a couple more things that you can do to help take care of that. If you want to look into the holistic side a bit further, you can actually grab a free copy of my Gut Rescue webinar below. It'll dive a lot more into the holistic side of things and what you can do and steps you can take into beginning to reverse the disease processes of your inflammatory bowel disease. Now, if you're looking for more information about inflammatory bowel disease, we're going to be creating and releasing new videos every single week. So make sure you hit the subscribe button and check the links below. You can head right to my website and take a look at the gut health solution. So let's take a deeper look now at Crohn's and colitis. Both types involve the colon, but ulcerative colitis, the word colitis is col and itis, which means colon and itis is inflammation. It's inflammation of the colon. So colitis specifically refers to the colon, whereas Crohn's can actually affect the entire GI system all the way from mouth to anus. Ulcerative colitis tends to be more specific to the lower parts of the colon, specifically the rectal and sigmoid colon, which is right at the very lower part of the colon. This is approximately 40 to 50% of cases, and it's actually termed proctitis. In Crohn's, it's primarily the cecum, which is the first part of the large intestine, where it connects with the ileum, which is the last part of the small intestine. About 40% of cases of Crohn's take place here. The small intestine is involved in about 30 to 40% of cases of Crohn's, and inflammation is segmented. It's called skip lesions, where you'll have inflammation and no inflammation in patches. And you can have these in the colon as well in about 20% of cases. And this is what's called Crohn's colitis. And roughly 10% or less of people dealing with Crohn's can also experience something called perianal inflammation, or inflammation on the outside of the anus. So some symptoms of inflammatory bowel disease can be things like diarrhea, rectal bleeding, mucus in the stool, painful bowel movements or pain on palpation that's putting pressure around the abdomen, which leads into abdominal tenderness. You can have changes in appetite, fever, weight gain or weight loss, vomiting, muscle cramps, and much, much more. Now, roughly 100,000 to 150,000 people per year are diagnosed with some sort of inflammatory bowel disease. Now, colitis specifically has continuous inflammatory lesions, which means it's one long strip. It's isolated more to the superficial tissues. That's the tissues right inside the colon. It doesn't go very deep. Whereas Crohn's tends to be patchy. Again, it's those skip lesions, which comes with more inflammation, and it tends to move around. It goes through all layers of the gut. It actually penetrates deeper into the intestinal walls. Now, some complications of colitis and Crohn's are things like bleeding, toxic megacolon, more for colitis, bowel rupture, which can lead to what's called a perforation, which means you can actually have toxins leaking into your abdominal cavity, which can be very toxic and life-threatening. Another complication of Crohn's and colitis is colon cancer. And for Crohn's, we also look at things like stenosis, which is a narrowing of that passageway through the intestines, abscesses, or a fistula, which is when infection will actually burrow itself into the intestine and can actually work through it, colon cancer, and again, perforation. So the question is, what can you do about it? Now, we talked about an immune component, so we know there's something to that, but it's not the only thing. You're not totally at the mercy of your immune system. There are so many other factors to consider which directly impact your gut health. Things like food and nutrition. Even when we're looking at basic foods, if you're eating a lot of crunchy, hard foods, steaks, and thick meats, try going to things like you would feed a toddler, which would be your soft fish, your sweet potatoes, really soft, mushy things. We can also look at eating more whole organic foods, decreasing things like pesticides, herbicides, and fungicides. going towards more whole foods, not refined foods. Stay away from sugars, staying away from alcohols, and things that we know are not very good for us, such as packaged, fried foods, hot dogs, chips, all of that. Some things we can do to help improve your system to allow it to recover more as well and improve your immune system function is going to be rest and stress management. There is a direct correlation between being high stress and having poor digestive function, which leads to bacterial dysregulation and all kinds of other issues. Other things we can do is get tests beyond just what they do in the hospital for a stool test. Typically in hospital, they'll check for things like MRSA. It's often referred to as MRSA. That stands for methicillin-resistant Staphylococcus aureus. It's just a bacterial-resistant staph bacteria. Other things they test for are things like C. diff or Clostridium difficile, E. coli, and other common terrible bacterial infections that can be quite lethal is what they test for in hospital. But something else we can do is to go a step further and go to a private lab and get something called a GI map. Now, I don't recommend just going and getting one out of nowhere because you need a professional to help you interpret it and produce a nice, safe, and effective protocol for rebalancing it. If we have a lot of bacterial issues and we go too far and start killing off a bunch of stuff, it can actually create a lot of toxicity in the body, creating migraines and flus and even liver and kidney damage. So we have to be very careful. Now, the steps we just listed can all help, but the true root causes can often go very deep. I've had clients go from severe colitis with 30+ bowel movements a day for 16 years who have seen many different doctors and specialists who had their symptoms completely reversed and totally symptom-free in just a couple of weeks. And I've had others who had it for just a few years and it's taken months to correct. So everybody is very, very different. This is another reason why I recommend, when in doubt, get professional help. And again, if you want to get more information about this, one, click the subscribe button. We're going to be releasing new videos all about inflammatory bowel disease every single week. You can also click the link directly below to check out my program on my website called the Gut Health Solution.